Hi, everyone. Thank you for joining us. My name is Randina Hoyt, and I am the president of the Pikes Breastfeeding Coalition. I am a DONA trained doula, and I just graduated with my Bachelor's of Science in Maternal Child Health and Human Lactation. And I am sitting for my International Board Certified Lactation exam in September of this year. And I also breastfed my daughter for 2.5 years, and she is now 7. So, if you have been following the Pikes Peak Breastfeeding Coalition's page the last few days, you may be aware that we're gearing up for the 2020 big virtual latch on this Saturday, starting at 10 a.m. Mountain Time, with the latch on to take place at 10:30. The Big Latch On is an event that happens the first weekend of August every year, and it is a global event. So if you haven't registered for that event yet, please see the link that is in our event on our Facebook page. We're so excited to have a unique opportunity this year to be able to host this event virtually so we can have more moms and families be able to join us from anywhere that you are, and even in the comfort of your own home. We will have a few speakers beginning at 10 a.m. before the latch at 10:30, which will include myself and International Board Certified Lactation Consultant Lauren Pilger from Wildflower Breastfeeding. We have had a few professionals that have come on to talk about many different topics throughout this week, such as Dr. Lauren from WOW Chiropractic, who talked about the importance of prenatal and neonatal chiropractic care. Some of our local La Leche League leaders have spoken about some of the things that they wish they had known before they started their breastfeeding journeys. And then, of course, our very own Laura Lydell, who spoke about breastfeeding during active duty in the military. So if you missed any of those videos, they're still uploaded on our page to the event. Go check them out. They're great videos. And also, please join us this Saturday at 10 a.m. Mountain Time to learn more about the Pikes Peak Breastfeeding Coalition, what we're doing here in our community, and also about the importance of breastfeeding through this pandemic that we are all trying to navigate. So today I'm going to talk about Polycystic Ovarian Syndrome, or otherwise known as PCOS, and how that can affect breastfeeding. If you're not familiar with PCOS, there are a few different kinds of PCOS. First is the kind that can cause cysts on your ovaries, which can make it difficult for some women to get pregnant. But the other aspect of PCOS is the hormonal imbalance. PCOS has a few different identifying traits that can help you to determine if you may be suffering with the hormonal imbalance. Some of these traits can include things like insufficient glandular tissue or the lack of breast tissue. Now, this doesn't necessarily mean that you would have like small breasts. Maybe you have larger breasts that just don't have volume, or they feel somewhat flat or deflated, or you have breasts that are tubular shape or are asymmetrical. Of course, we all know that women's breasts, one breast is typically larger than the other. So we're not talking about just a slight difference in size. We're talking about a significant difference. But women with PCOS may also experience irregular periods or the absence of their menstrual cycles, or abnormally heavy menstrual cycles. Obesity and the difficulty to lose weight can also be a sign of women that may be struggling with PCOS. Acne and excess of body or facial hair, as well as due to, which would be due to higher amounts of androgens in the body. These, of course, are only some of the symptoms. But if you do become pregnant and plan to breastfeed, there are some additional signs that you may want to be aware of, so that you know what kind of challenges you might be facing with breastfeeding. So the first sign that you might notice is that there is no changes in your breasts during pregnancy. Most women notice their breast size change during pregnancy, and if you don't see this, that may show that you are lacking some of the glandular tissue and milk ducts that are needed to be able to start producing milk. So if you've given birth and you still don't see a change in your breasts or feel the fullness that we talk about when the milk starts to come in just a few days after having your baby. In the first few days, you will produce what's called colostrum. That is the thick, sticky milk that is full of the perfect amount of antibiotics, fat, protein, nutrients, and calories that are just exactly what your baby needs to fill up their tiny little tummy. So this, of course, is the time that babies need skin to skin with mom to help regulate their heartbeat and body temperature and to make them feel safe and secure. Skin to skin also helps to send signals to mom's body to tell it to kick up the milk production. But of course, in these earlier days, baby will also be breastfeeding quite often, and that is totally normal. It's because their tummy is so small, and the amount of colostrum that they're taking in is in very, very tiny amounts too. But within about 3 to 5 days after birth, you should notice the colostrum start to change color and consistency and turn to a thinner, milkier substance. Some women during this time will also notice a change in their breasts and may begin to feel engorgement. And at this stage, if you don't notice this change, we would highly recommend that you seek professional help from a licensed IBCLC. You may have the contact information for the IBCLC that you saw in the hospital or the birthing center that you gave birth. But if you don't have an IBCLC and you feel that you need help finding one, you are more than welcome to contact anybody here at the Pikes Breastfeeding Coalition. We can help you get in contact with somebody. And then you can also go back and watch the information from the Leche League leaders. They have a hotline that you can contact at any time. And then there's also the Leche League groups that happen all around the country. But if you don't experience this particular change in your breast and you notice that your baby is either very fussy at the breast, seems like they are not getting enough while feeding, are taking too long to feed at the breast, and are falling asleep very easily at the breast, these may indicate that baby is not getting enough for them to stay awake and to stay motivated to continue to try to feed. Another indicator would be that baby is not getting enough weight on a consistent basis, or is not having a good amount of wet and dirty diapers, and is not showing cues of alertness. So these can be signs that your body may not be producing enough milk for baby. And then at that point, it would be imperative for you to seek out professional help from an IBCLC. But talking about all the signs and things to look out for, there are plenty of things that you can do to help increase your milk supply. The first we would always suggest is trying to get baby to breast as much as possible and consistent skin to skin. Your breasts are a supply and demand factory. The more demand, the more your supply will increase. This is also true of women that have PCOS. Even if they may not have the quantity of glandular tissue, doesn't mean they can't produce a good quantity of milk from the milk ducts that they do have. So keep putting baby to breast. Another option is to introduce pumping to help increase the demand. Along with pumping with the breast pump, you can also use hands-on pumping, which is using breast massage and breast compressions to help move the milk through the milk ducts to help stimulate more production. Another option, which is quite common, may be natural herbal galactagogues or supplements, which can also help with milk production as well. But since I'm not a physician or an herbalist or an IBCLC yet, I will leave that information up to you to do your research and to talk with an IBCLC or your physician. If these suggestions don't help to increase your supply, I again would urge you to contact an IBCLC as soon as possible to look at other options and techniques that you can try beyond the ones that I've mentioned. There are still more options available. And if you are struggling with PCOS or even low supply, please don't be discouraged. I personally struggled with PCOS and had low milk supply from the very beginning. And with the help of some amazing IBCLCs and a lot of dedication, I was able to come out breastfeeding my daughter for 2.5 years. And you can do it too. Thank you all for watching, and we really hope to see you tomorrow. Bye.